There, there, and it should be recording now.
Great. So do you just want me to get started then?
Yes, actually, let me introduce you first. Well, thank you so much for joining us. We really appreciate you sparing your time today. So we are joined by Dr. Sabira Taher. She is an engagement officer with the PCORI's engagement service, engagement science and practice team. She provides awardees with thought leadership and expert guidance on how to use effective patient engagement strategies in pragmatic research trials to improve patient-centered outcomes. Thank you so much for joining us today, Dr. Taher, and we look forward to your presentation.
Thank you so much. I'm excited to be here today to talk about how PCORI incorporates patient and community engagement in research and answer any questions you may have about getting involved. Next slide, please.
Sorry, 1 second. There we go.
Perfect. So this is the agenda for today. I'll give a little bit of an overview about PCORI. I'll talk about the importance of engagement in research at PCORI. I'll talk about PCORI engagement initiatives, some examples of engagement in PCORI-funded research, PCORI engagement resources, and then we'll round it all out with some Q&A if anybody is online. I'm not sure if they're online for that, but next slide, please. So we'll start with the PCORI overview. Next slide. So PCORI is a nonprofit agency that funds patient-centered comparative clinical effectiveness research, which I will refer to as CER in this presentation. And CER compares the benefits and potential harms of different healthcare options to provide evidence that patients and other healthcare decision makers can use to make informed choices about which option best meets their needs. And this is really vital in today's healthcare landscape because we have an ever-increasing number of effective care options for many conditions, but too often people face choices without the right information to help them weigh the trade-offs of those options. So PCORI's unique place in the health research landscape stems from its focus on patients and their outcomes. PCORI is widely recognized as a leader in driving U.S. clinical research to be more patient-centered, which results in evidence that is more relevant and useful. PCORI emphasizes the engagement of patients, caregivers, and the broader healthcare community in all aspects of PCORI-funded research, as well as the dissemination and uptake of research findings. Next slide, please. Our charge is straightforward. Provide the information to help people make informed healthcare decisions. We do this by producing and promoting high-integrity, evidence-based information from research guided by patients, caregivers, and the broader healthcare community. PCORI's work focuses in 4 major areas: funding of patient-centered CER, engagement in research, dissemination and implementation of PCORI-funded study results, and building research infrastructure. A good example of this is PCORNet, a national resource and database that documents the healthcare experiences of millions of patients in research nationwide to improve the accuracy, efficiency, and relevance of CER. Next slide, please. So PCORI funds patient-centered CER, issuing funding opportunity announcements several times a year. PCORI funds projects that support CER, such as methods development for conducting patient-centered CER and the science of engagement in patient-centered CER. Further, PCORI funds projects that support engagement in research and the dissemination and implementation of PCORI-funded research findings. Next slide, please. PCORI's research project agenda comprises a set of evolving topic themes that informs patient-centered CER funding opportunities that address the national priorities for health listed on this slide. These topics represent widespread and interconnected health conditions across the United States. Ongoing engagement of patients, caregivers, and the broader healthcare community drives further refinement of these themes over time to identify gaps and meet patient needs. Next slide, please. So now I want to talk a little bit more about the importance of engagement in research. Next slide, please. Engagement in research is about creative, active partnerships between researchers and those most impacted by the healthcare system or the health condition. And this includes patients, caregivers, clinicians, and other relevant communities. These partners contribute throughout the entire research process, from planning the research to conducting the study and sharing the results. Next slide, please. So as you can see here, this is how PCORI involves partners and collaborators. They're involved in research partnership development, through research topic identification, through conduct of research, review of findings, and dissemination and implementation of findings. Next slide, please. Our experience with hundreds of funded research projects have shown the clear value of engaging patients and other partners in research. This engagement enhances studies in multiple ways. It makes them more feasible in pragmatic settings, it improves the quality of findings, and increases the likelihood that these findings will be used in practice. Through these partnerships, researchers gain deeper insights into patients' lives and clinical realities. At the same time, patient partners develop new skills, make meaningful contributions, and oftentimes see improvements in their own health. When partners are genuinely included in decision-making, the resulting relationships strengthen both research institutions and communities. Next slide, please. So here is a summary of important findings about engagement. Engagement works across all research phases and can involve many types of partners. It shapes how studies are designed and conducted, making them more relevant and feasible. And we found that partner involvement evolves naturally throughout a study. It benefits everyone involved, from individual participants to entire communities. And our approach is helping transform the research culture, though challenges do remain. These include resource limitations, team dynamics, organizational policies, and balancing different perspectives. And while we've made significant progress in engagement in research, we continue to study how it evolves through our science of engagement and practice research efforts. Next slide, please. So now I'll present PCORI engagement initiatives that might be useful for your constituents. These initiatives focus on building research communities rather than funding the research itself. Next slide, please. So PCORI's Ambassador Program leverages the perspectives and leadership of healthcare partners, networks, patients, caregivers, and communities to advance patient-centered CER. Ambassadors are trained to meaningfully collaborate with researchers in different ways on patient-centered research and other projects. They help to identify gaps and expedite the dissemination and implementation of research findings throughout their networks and local communities. Next slide, please. The activities that ambassadors engage in are far-reaching and varied. They build and promote patient-centered research outcomes throughout their traditional and virtual communities. And what we've seen as a result is empowered communities that are encouraged to participate in PCORI's work. They also share and translate research findings that resonate with and activate community members. Some examples are writing guest blogs, op-eds, newsletters, articles, really leveraging social and traditional media opportunities to highlight PCORI's work. They engage with PCORI as a diverse body of stakeholders for potential involvement in merit review, peer review, or advisory panels. And they become involved eventually as partners in a research award. They recruit and retain PCORI supporters by promoting funding opportunities with potential applicants such as researchers, health systems, and community-based organizations, and they function as recruiters for future ambassadors into the Ambassador Program. Next slide, please. The Eugene Washington Engagement Award program supports projects that aim to build a community better able to participate in patient-centered outcomes CER and serve as channels to disseminate study results. As a reminder, this program is not a research funding opportunity, but rather a way to build capacity to conduct research and to share research results. Next slide, please. On this slide, you'll see the 3 funding opportunities for engagement awards. You'll see that they vary from $125,000 to $300,000 for 1 to 2 years. If you would like more information, please visit this website on this slide here, and I believe you will be given access to the slides after this presentation. Next slide, please. So now I'll share some examples of how awardees engage with patients, specifically on PCORI-funded Parkinson's disease studies, which you might find relevant to your work. Next slide, please. So this was a CER study that examined the effectiveness of outpatient palliative care plus usual care compared to the outcomes of usual care alone to improve quality of life and reduce the burden for older patients with Parkinson's disease and their caregivers over 12 months. This study included 210 patients across 3 large geographically diverse neurologic clinics in the United States and in Canada. The palliative care intervention was specifically grounded in a team-based care model that included neurologists, social workers, nurses, and chaplains, following a standardized protocol to address physical symptoms, psychosocial issues, advanced care planning, and spiritual well-being. Usual care denoted regular visits with a primary care provider and a neurologist. Next slide, please. Engagement for the study was grounded in a patient and caregiver advisory panel that was made up of patients, caregivers, and relevant advocacy organization representatives. During the life cycle of the study, the panel was involved with study design, implementation, and dissemination of study results. They provided input on the development of data collection tools, study recruitment plans, and necessary intervention adaptations to achieve patient-centeredness. And each site had at least one dedicated patient team member assigned to it. And this person assisted researchers with recruitment, communication with study participants, review of study outcomes, review of dropout rates and adverse events, and assisted with study adaptations. Next slide, please. So the study outcomes were that the outpatient palliative care intervention provided benefits to patient and caregiver quality of life and reduced burden compared to standard care alone. The research results were used to support ongoing efforts to integrate a team-based and sustainable palliative care model into standard care for individuals living with Parkinson's disease. The program addressed patients' pain, emotional well-being, social support, and care planning, as well as family care partner support. Next slide, please. So building on the previous CER study, this next study was an implementation study to test wide-scale implementation of the team-based palliative care intervention. The purpose was to expand the team-based palliative care model to medical centers across the U.S. that serve patients with Parkinson's disease. The study included 34 U.S. health centers across 22 states designated as centers of excellence by the Parkinson's Foundation that serve 140,000 patients annually. The overall goal was to make team-based palliative care a core value and a service of the Parkinson's Foundation and their Centers of Excellence network. Next slide, please. So engagement in this study was leveraged using a patient and care partner advisory board. And the board helped patient centers develop palliative care teams, adapt patient screening and other processes, adapt clinician checklists and other materials, and train staff at each center, providing ongoing coaching, support, and feedback as well. Next slide, please. Some of the engagement activities included quarterly stakeholder advisory council meetings with patients, families, clinicians, and Parkinson's Foundation leadership. Ad hoc meetings were conducted with hospitals, clinicians, and other community support organizations to further support implementation and sustainability. Next slide, please. So implementation study outcomes were that 33 of the 34 Parkinson's Foundation Centers of Excellence took part to implement palliative care services. 25 centers improved on at least one aspect of palliative care. 589 clinicians and staff at the centers completed the online training, and the project team held 215 coaching meetings with center directors and champions. Roughly 44,800 patients received palliative care, and that's about 68% of center patients. 95% of patients and families reported being either completely or very satisfied with the quality of care they received. And improvements were observed in quality of life, and this included spiritual and emotional issues, addressing care partner needs, advancements in care planning, identification of goals of care, and an increase in referrals to specialty palliative care services. Next slide, please. So now I want to talk a little bit about PCORI engagement tools and resources that may be useful to your organization. Next slide, please. So PCORI's 6 foundational expectations for engagement and research provide guidelines and concrete examples for how to establish a successful engagement approach for your study. While each expectation stands alone, they work together as an interconnected system, helping study teams create meaningful and lasting partnerships. Awardees adapt the foundational expectations to their study and engagement needs. It's helped them to maximize partner contributions throughout all project phases to achieve goals and outcomes. And it's helped to facilitate engagement discussions and planning for patient-centered CER. It really has helped study team members utilize and enhance team member strengths and assets. On this slide, you see links to resources that can be found on the PCORI website. You'll find definitions of each expectation, how the expectation has helped projects, including multiple examples of how PCORI-funded projects demonstrated the expectations. Next slide, please. So to encourage the spread of engagement practices within the wider research community, PCORI has assembled a repository of more than 400 engagement-related tools and resources developed and used by PCORI awardees. This searchable peer-to-peer repository includes case studies, toolkits, training manuals, tip sheets, and more. And you can scan the QR code to access these materials. Next slide, please. So if you're interested in staying current on all things PCORI, PCORI sends out weekly emails about opportunities to apply for funding, newly funded research studies and engagement projects, results of our funded research, webinars, and other new information posted on our site. So you can sign up and receive our weekly email by visiting the website on this slide or by scanning the QR code. Next slide, please. And that's it for my talk today. I want to thank you again for your time. And if anybody has any questions, I guess feel free to ask me.
Thanks so much, Dr. Taher. Really appreciate that. That was a great talk. I'm actually going to put up the QR code up, just share that just for people to, so that they can actually have a look at it. I'm not quite sure whether can you still see it? Yeah. So I actually have, so thank you. I'll get started with the questions. So we at Collabior are trying to give people the ability to stay more proactive in their care and really stay up to date on, the information about their condition as well as clinical trials. And so our population of patients and caregivers tend to be very interested in what PCORI is doing. I guess my first question is, how does a patient become involved in these initiatives? Are there certain, because PCORI funds certain studies, are there specific means by which people can become involved? You mentioned the ambassador program. Are these opportunities that people apply for, or if you can maybe speak to that?
Sure. Yes. The ambassador program is something that patients can get involved in. Typically, they would have to apply. We review applications a couple of times a year. And I believe it is a 2 to 4 year commitment. And it's a really wonderful way to get involved. I am not involved in the ambassador program per se, but certainly you can look online for more information. And that's a really good foot in the door if that's the way that a lot of patients get involved and then become advocates within their community around patient-centered outcomes research.
Nice, thank you. I actually had a few people send in questions beforehand as well, just given our time limitation so that this goes a bit smoothly. But the second question I had here, just based on the slides that you'd presented, was how can patients find out about PCORI-funded studies relevant to their condition?
They can actually go to, if you go to some of the slides, there's the information. There's an actual, let's see, actually, this would be a good place to start as well. This QR code will take you to, if you want to scroll down a little bit further to that resource page. Yeah. This
Okay.
QR code, it's engagement tool and resource repository, but it is embedded within studies that have been completed. And so there are links out to publications, white papers, etc., on these studies that they can, and it's searchable by disease condition. So linking on, going through this QR code will take you to a landing page, and you can search by disease condition or whatever other topic you'd like to. You can do a literature search. There's a lot of different options, and I would say this is a good place to start.
Nice. And as a clinician, how do we get involved in PCORI-funded trials? Is it a process that typically involves applying for funding and then being selected as a potential site to work with PCORI, or are there multi-center opportunities that we can highlight our interest in and become involved?
Yeah, that's a great question. As a researcher, you can also become a research representative in the ambassador program. We do like to have a broad mix of ambassadors that include clinician researchers, clinicians themselves, patients, caregivers, policymakers, etc. So that is one way to get your foot in the door. We also do have, because our studies do require multi-sites, we do typically have PIs collaborate with each other as co-Is and apply for funding together. And so if you have connections with other awardees, that's one way to get your foot in the door. But certainly with the ambassador program, you will meet other clinicians and you will become more familiar with the process at PCORI to then be able to consider planning and a letter of intent that responds to one of our PFAs, and then start the process that way.
Nice, because I think there's a big move towards that, and I think we're recognizing that we need patients' input when we do our clinical trials, just to make sure that whatever we're studying is actually relevant to them. So this is a great opportunity to do so, and I think especially for a lot of junior investigators just getting their foot in the door, this is a great opportunity to commit to a very, very good cause. The other question is, given PCORI's funding, how do you select what trials tend to get funded? Are there certain conditions, and where do neurological conditions kind of fit in terms of the whole funding opportunity and funding priority with PCORI?
Well, if you scroll back up, and it's on this slide, we have the National Priorities of Health slide, and that's a really good place to start.
Okay. I think that may have been beforehand.
Yeah,
somewhere.
And you would respond to PFAs that are on a rolling basis. So if I was you or anybody else interested in learning more about upcoming PFAs and what disease topic is going to be covered, I would sign up for the weekly newsletter, and that will give you upcoming PFAs to respond to. They will give you information to speakers bureaus, like what I'm doing today, or town halls, which are informational, and you can attend those. We have a variety of town halls on the different topical areas, and we talk about merit review and our methodology standards and what we're looking for in engagement. And that's also an opportunity during those town halls to be able to ask questions, especially if PCORI is new to you.
Thank you. And if I can squeeze in one question in the minute that we have left. One of the questions was, how do patients actually become informed of the trials that they're participating in? That's a big concern, just even in the clinical trials that we run at academic centers. But does PCORI funded trials have a different approach to this, where they actually ensure that the people are informed of the results of the studies that they participate in?
Yes, we do require at the completion of a study that those results are disseminated in some way to the population that was participating in the study. I'm also thinking that in terms of engaging patients as research partners, if you decide that you do not want to share study results, you might get some pushback from your partners. So we do encourage you to do that and to include that as a part of your dissemination activities in your proposal. And that really alludes to the patient-centeredness as a part of our mission, and being absolutely transparent about the kinds of research that you're doing with your patients, whether they're the actual participant in the study or if they're a research partner in the study and a part of developing the research process.
Perfect. Well, thank you so much. I think that brings us right to 1:30. Thank you for sharing your slides today, and I'll be sure to send that over to our patient organizations as well. And if they have any further questions, is there a way that an informational page that they can inquire further
Let's see, on a slide,
questions or concerns about?
I think I was going to include a link to the slide. I would say go ahead and circulate my email.
Okay.
My PCORI email.
Okay.
And I will forward that on. If they're engagement related questions, I can answer those questions very easily. But I will forward them on to our science colleagues if there's a methodology question or anything else outside of engagement. I will get it to the right person.
Perfect. Thank you so much, Dr. Taher. We really appreciate your time.
Thanks so much. I really appreciate it. I
Take
hope
care.
to see you soon on a town hall.
Yes, absolutely. And safe flight.
Thanks so much.
Take care.
Bye.
Bye.